Good morning, everyone. I'm Dr. Bruce Moskowitz. This morning we're going to be doing a saline trial on a first-time filler patient. We use normal saline with a little bit of lidocaine with epinephrine in it. Take the sting off. And what we do is we use saline, or just plain water, for injection. And we can give it in the areas we're thinking of doing fillers to see if the patient likes it. I typically numb up one side with a topical anesthetic. Then I take normal saline for injection, add a little lidocaine to it, take the sting off a little bit more. What we do is then we give saline on one side, give the patient a mirror. It's not exactly accurate compared to fillers because fillers will sit there like a gel, whereas saline is essentially liquid and it will fan out. So it lasts a short period of time. Even if we give a fair amount of the saline on one side, the only downside can happen is a little bit of bruising, which is uncommon, but it can happen with a filler as well. The only other downside is that it will look a little bit different from side to side for a few hours and the body will absorb this right away. So here we're going to go. What we're going to do is we're going to inject the nasolabial fold and the cheek, because if you elevate the cheek, that will soften the fold and reduce the amount of volume that you need. On the cheekbone, two different locations, to define the cheekbone a little bit better. And as we blow this up, how are you feeling, by the way? Not too bad?
Good, not bad.
Good. See, we can soften it a little bit, just like we would with filler. We can define the cheekbone better, and then what we can do is we can soften the nasolabial fold by giving little bits of volume here. Take a look from side to side. Now, I'm using a fair amount more volume than I would with filler because of the spreading properties of it. To bring that up, let me just put a little bit of pressure on the wound. And take a look, Else, and you tell me the difference side to side. Well, this allows her to make a decision on whether it's going to be useful to do fillers or not in the future.
Wow.